Okay, so first I wash my hands, then I clean my workstation using a bleach wipe. Remember, you wash your hands for 20 seconds using antibacterial soap. And now I'm gathering my supplies. So first, I have my blue pad that I'm going to put on top of my workstation. On top of that blue pad, I'm going to put down some gauze, some Alkavis, that's the cleaning solution to clean my transfer set, hand sanitizer, my dialysis bag. I'm also going to get some gloves because my company requires the use of gloves. I'm going to grab a mask. I've already made sure the door was closed, the fan was off, the vent was closed, and the windows were closed. All pets out of the room. Now I'm going to get my clamps, my blue clamp and my red clamp. And now I need my IV pole. So I'm going to grab my pole and pull it over. I'm going to raise the IV pole up. The higher the pole, the faster the dialysate will fill inside of my abdomen. Now I'm opening my bag, looking at my bag, making sure nothing's wrong with it. So I'm peeling off the drain bag and peeling off the tubes that's all stuck together. Takes a little bit of effort, not too much. And remember, I'm going to use the acronym SCALE, SCALE. So S, I'm checking for my solution strength at the top, the side, and the red cap, 4.25. That's what I want. C for clarity. I'm putting a package on the back of it. I can read through it. A for amount. I have the right amount. Right now I'm checking for leaks, and I looked at the expiration date, and it wasn't expired. Now I'm going to take my drain bag. I'm going to put it shiny side up, dull side to the ground. And I'm going to sanitize my hands. I'm going to put my clamp on. So I have my blue clamp that goes to the drain line and the red clamp that goes to the fill line. And I put that red clamp on the fill line to just remind me that I have to do something before I take that red clamp off. Now I'm putting on my gloves, and I do have an apron that I'm going to wear that will allow me to do the dialysis exchange that I'm going to put on later. So what I'm doing right now is putting Alkavis on my 4x4 gauze, getting that ready. And I'm looking for my apron, and I found it. Putting my apron on. I have a bag there that will drain, and I have a transfer set that will connect to the dialysate fluid. And now I'm going to grab also a blue pad to put on my lap so I don't spill anything on my clothing. So untape the transfer set from your body or take it out of the belt wherever you have your transfer set at, and scrub for 1 minute. So I'm not actually going to scrub for a minute, so you can add a minute to this video. And then take your other piece of gauze and wrap it around your transfer set for 1 minute. I'm also not going to do it for a full minute, so you can add a minute to this video. Now this is a pop quiz for my patients. There's something I'm missing right now. Something very important. That's right, my mask. There we go. I didn't put my mask on. Always wear your mask before opening your transfer set. Never open it without your mask being on. Now, like I said, loosen the cap, put the pull ring on my finger, and pull it off. Take the cap off, connect your transfer set to the bag, and take the gauze and wipe around that area because iodine may be there and that can stain your clothing. Now I'm ready to drain. So I unclamp the blue drain line. I break the frangible, and I open my transfer set. And if this is your first drain of the day, most of the time you won't have anything in there. Maybe a little bit will come out. And if you can look at the bag, you'll see some stuff going in the bag. Draining usually takes between 10 to 15 minutes. So if you are filled with fluid, that's how long it would take. If this is your first exchange of the day, then it should just take maybe a minute or less. So I close my transfer set because I'm done draining. Now I'm going to look at the fill line, look at my red clamp, and remember there's air in that line that I need to flush out. Take the clamp off, break the frangible. I see the fluid rushing down. I count to 3 Mississippi, and then I clamp that drain line. Now I'm looking at the line, making sure it's filled with fluid, and I open my transfer set. And now I'm filling. I can actually feel the bag on my lap getting bigger and bigger. And this also takes about 10 to 15 minutes to put that whole 2-liter bag inside. Once that's done, I close my transfer set. I put the clamp back on the fill line. There's always something in there. So if I disconnect it and I didn't have a clamp there, something would squirt out at me. So now I'm opening my second pack of 4x4 gauze, and I'm going to pour Alka-Vis on it. I need to clean my transfer set again now that I'm disconnecting. I'm going to scrub for 1 full minute, making sure I don't untwist the transfer set from the bag. And then I'm going to wrap for 1 full minute. Now, if you've done manual dialysis before, you may have noticed that I don't have something with me. I don't have my new mini cap, the cap that goes on the transfer set. Now, fortunately for me, my mini caps are within reach. If your mini caps are in your closet or in another room, this will be more difficult. So always remember to have your full supplies with you. I grabbed 2 mini caps. I checked the expiration dates. I grabbed 2 mini caps just in case I accidentally drop 1 mini cap. So always have 2 with you before you disconnect. And bam, look at that. Wow, unbelievable. I dropped the mini cap, but I have another one. And this time I'm going to open it on my table so it won't fly in the air. I'm going to look inside, make sure there's iodine in there. Disconnect it from the bag, put my cap on, and I'm done. I've officially finished my manual exchange. The whole process takes just under 30 minutes or 20 minutes, depending on if you already have fluid inside of you when you start. Thanks for watching. Bye.